A history of Bethlem Hospital in 4 lists might sound a bit dull, but actually it's a good way of quickly getting to the heart of some of the key perennial issues in mental health care. I have here a list of names of Bethlem patients made in 1624 when the hospital was on its first site in Bishopsgate in central London. The list was made by the hospital's governors, who since 1619 had left the day-to-day management of the hospital and its finances in the hands of a keeper named Hilkiah Crook. But in 1624 they restricted patient numbers to a maximum of 25 and insisted that all admissions were subject to their approval. This was the result of the visit they made in that year, 1624, to see what was going on at the hospital. This was kind of like a CQC inspection, 17th century style. The list details what they had found out. The hospital was overcrowded with 31 patients, several of whom had been admitted without the governor's knowledge, and 45% of whom were not found suitable to remain in the hospital, either because they were not sufficiently mentally unwell to justify admission, or they'd recovered, or they were physically but not mentally unwell, or they were in a state that would not admit of recovery. Philip Manger, for example, was recovered and ordered to be sent to some other hospital, being only lame of his feet. Anne Parrott was somewhat idle-headed, but ordered to be removed. Mary Thompson was a poor idiot, in the stigmatizing language of the time, who was not fit to be kept in this house in Bethlem. The list doesn't tell us how things had gotten so bad, but some years after the list was made, Hilkiah Crook was suspended from his duties at the hospital, having been charged with pocketing most of the fees that were paid directly to him for patients' upkeep. The moral of this story is that even in the 17th century, malpractice did not go unnoticed and unpunished forever.